2, 1. Okay. Today we're here with the Hopi Diabetes Prevention Program, and we'll be discussing the topic of women and diabetes, what to know about diabetes from a female perspective. And today we are, I would like to invite Jessica Kamahonyewa. Did I say that right, Jessica? Okay.
Yes, you did.
She's a diabetes prevention educator. She's been with the diabetes program for a number of years, and she's very experienced with this field. And so I will go ahead and let her take it away. This is a part of our 2022 National Women's Health Week. And we are going to go ahead and give the reins to Jessica. Thank you, Jessica.
Hi, thank you for inviting me. And yes, again, quick introduction of myself. I am Jessica Kamahunua, diabetes prevention educator for the Hopi Special Diabetes Program. And I have been with the diabetes program for going on 16 years come September. My, how time flies when you're having so much fun with a program that allows you to be outside the box and be out in the community and be able to educate and empower our community in taking better care of ourselves and our health, because that's all we have to look forward to and be able to be stronger, and also to understand that diabetes is preventative if we take early steps in understanding and listening to our bodies mainly. And so for you today, I have a PowerPoint, and it's about women and diabetes. So let's go ahead and get started. So with diabetes, it is a condition that happens later on in life. Again, that depends on how well we take care of ourselves, take care of our bodies, and if we're them kind of individuals. And as women, we should be those individuals that take care of ourselves every day, not only with how we eat, how we take care of our families, but also to understand that we, as women, we should also be including annual women's health services, as far as going to a healthcare provider and establishing care, especially early on in life, when we start to not only grow from our childhood, but mature into our teenage years. And then with that, the growth of becoming women, and then we're having children, and we also want to have healthy children. And so with women, managing and taking care of ourselves comes very early on in life, compared to men. And out here on Hopi, it does take a lot of courage for our men to establish that self-care. And it's us as women that should be encouraging them as well to be taking better care of ourselves. And so when we talk about diabetes, we talk about how it changes because we don't even think to ourselves how our bodies are taking care of themselves, whether we're listening to signs or symptoms that we may be having as we're growing and carrying on with our daily lives. So when it comes to diabetes care, women with diabetes have much more to manage. And a lot of it, again, as you see here, are these topics that we're talking about almost on a daily basis. And that's with staying on track by checking our blood sugars, eating healthy foods, being active, taking care of our families, and depression. And so when we talk about staying on track, a lot of times we don't know if we're diabetic or if we're at risk for having diabetes. And so again, it all depends on our ethnicity, and it also depends on our family health history. And it also depends on if you have had some shown symptoms of diabetes. Maybe you're experiencing frequent thirst. Maybe if you're a person that doesn't have breakfast and you're going on through your day and you're having the shaking or nervous symptoms. So a lot of these symptoms, we don't even realize it could be leading to potential dangers when it comes to understanding or whether we want to find out if we have diabetes. Or the other thing that also comes along when we talk about diabetes is high blood pressure. And so the thing with this is that if a person is diagnosed with diabetes and they don't take care, one doesn't take care of their blood sugars, then it also leads to bringing on our stress levels, and which can lead to high blood pressure. And so those types of health risks come hand in hand when we're talking about diabetes care. So and the reason for that is because they affect the same organs, they have the same symptoms, they affect our brain, they affect our vision, they affect our hearts, our blood circulation, and so and then also our kidneys. And then, of course, the pancreas, where the insulin is being produced. And so a lot of these, we don't think about that. They do bring harm. And so if a person was diagnosed with diabetes and they don't take care of their blood sugars, like I said before, and then, stress comes on and we don't watch what we're eating, then high blood pressure also becomes a factor or becomes involved. And that's vice versa. A person that does have high blood pressure and they're not managing that high blood pressure, and or they're not getting early care, then diabetes comes along. And so they come hand in hand. Their brother and sister, they're best friends. And so so that's why it's really important to start listening to our bodies and start finding out whether we're at risk. And I did mention the risk earlier. Eating healthy foods. There's no such thing as good foods, bad foods. The main focus on when we're talking about eating healthy foods when it comes to diabetes care is whether it's healthy or unhealthy. And so I just want that, to get that out there, that there, I don't want you guys to think that there's good foods and bad foods. Let's start thinking them as unhealthy foods and healthy foods. And so when it comes to diabetes care, there's really no true diet when it comes to better managing our diabetes. And so it comes with just better understanding the foods that make our sugars go high, the foods that we like to indulge in, are they unhealthy or are they healthy? And the other part of diabetes care is being active. With the CDC recommendations for diabetes care, being active for at least 150 minutes per week, not a day, per week, 150 minutes. That's a time that's doable. It's a time that you set aside for yourself to be more active. And being active doesn't mean you go out and start running. Being active means choosing a physical activity that you enjoy. So if you enjoy going for a walk, make that walk turn into 30 minutes. And if you haven't been walking, let's just start small. And we want you to be able to start at a place where you're safe and you're able to get through your physical activity in a safe way, and able to let your family know on the trails that you may be going on. And so when it comes to being active, let's not think of it as exercise. Let's think of it as physical activity where we're able to do an activity that is more enjoyable for you. And it doesn't always just have to be for you. You can also include your loved ones, your family members, to be out on those trails at the same time as you, and turn it into some good family time. Taking care of family is a mother's endless job, and we want to be those types of mothers that are going to always be there and be able to take care of our families and watch over them in a good way, and to be able to understand some of the things that maybe families aren't even allowed to or able to share. And those mothers are the ones that are the secret keepers. And if it's something that, family members want to keep in confidence, that's where it starts at, is, having that trust. And that's where a lot of the diabetes care is coming from, is having that trust, not only in yourselves, but maybe in a family member, or sharing it as a family. Because like I said, a lot of times our health history isn't shared with our loved ones. And so let's start sharing those issues that we're having as families, to make our bond as families stronger. Another thing that comes across is the depression, especially when someone is told that they're pre-diabetic. And I know this can be a conflicting and can be often be misleading, because some physicians will tell their patients that they're borderline. And so that's something that we've been wanting to educate and have our audience know that there's really no such thing as borderline. Either you're diagnosed as a diabetic or not a diabetic. And so that's where the pre-diabetes comes in, is because you're at risk for becoming diabetic, but there's preventative measures that you can take because it's been detected early, and you're able to take the steps required to change that around, and you're given that time to establish the care that you want, whether it be with meds or without medication. And so And that's where depression comes in. And a lot of times, it's news that we're not wanting to accept, but it's going to take time. And like I said, with good coaching and the good support that you have with your healthcare provider, that's where you want to have that comfort in and better understanding and coping with what we need to handle on a day-to-day situation. So as I was talking about how diabetes affects different women versus men, we have a lot of other issues when it comes to better taking care of ourselves. And this is a topic that no woman likes to encounter, and that's the yeast and urinary tract infection. And so, as you see here, more than 50% of women will get urinary tract infection in their lifetime. And that's only because of uncontrolled sugar levels that is happening in our bodies. And a lot of times we don't take that time to go to the restrooms frequently. And so we're not being consistent in that. And so that, when women do go to the restroom, their bladders aren't emptying all the way. And so whatever is held behind, that's what's going to bring on the yeast and the urinary tract infection. And then also not drinking enough water. As women, we should have our hydration level at least within the 40%. And how you find out if you're getting enough hydration, the main signs for that is, if you have dry, chappy lips, that's a sure indicator that you're not well hydrated. Another indicator is if you pinch your finger like this and it doesn't rise right away, that shows also that you're not hydrated enough. And so when I talk about hydration, other ways to be hydrated are not only drinking enough water. And I know sometimes people will drink too much water where they'll get sick from drinking too much water. And so other ways that you can hydrate is by having more fruits and vegetables in your diet. Believe it or not, the fruits and vegetables have a lot of good nutrients, a lot of the good hydration mechanisms that do come in these fruits and vegetables. And so if you were to want to drink an orange, if you were to want to enjoy an orange juice, your best way or your best choice in having that orange juice is that it comes straight from the fruit rather than having it be in the containers where they're put on the shelf and stored with all these preservatives and have all these added calories. And so it's really important that as women, we understand the values that we have that come naturally in the fruits and vegetables that we eat. And so it also, when we do have all these fruits and vegetables, there's also all these fighting mechanisms that are in these foods that we eat naturally. And so a lot of it's not coming through preservatives. And so just creating a good environment to where you're able to get more hydration into your bodies. And this is the next topic that I know a lot of us as women don't really enjoy, but it's the joys of life that come, and most times it's in the menstrual cycle is something that we don't quite welcome on a monthly basis. And so when we don't take better control of our blood sugars, you'll notice a pattern over time. And a lot of times you'll also notice that the cycles are always different. And, it comes because of the hormonal changes or the levels that our bodies go through before and during the cycles. And where some of us are blessed with short cycles, and some of us just dread the long cycles and the heavier cycles. And so a lot of these are, again, if you don't know that you're a diabetic, that's probably something that you might want to have a discussion with your care provider to better understand the menstrual cycles, because like I said, our menstrual cycles also reflect on our circulatory system, the blood that's flowing through our entire body. It goes to our brains, it goes to our eyes, to the tips of our fingers, all the way to our toes. And so that blood circulation does have an effect on our menstrual cycle. And so it's just better understanding that when you notice these things or the changes, it's a topic that you would want to ask your healthcare provider. And what also messes up our menstrual cycle is our food cravings and the types of food cravings. Okay, so remember, we're doing away with bad foods, good foods. We're doing the unhealthy and healthy choices. And so when we talk about these food cravings, we don't realize that sometimes when we pick up food, it might be food for comfort, because when we're on these menstrual cycles, you often think, God, I'm really feeling bummed out. I think I'll have this bag of chips. Okay, that's something really quick and easy, right? And so instead of maybe grabbing for that bag of chips, grab for something else that's a lot more quick and simple to snack on, to satisfy you from the comfort that you're seeking. And so, an apple with some peanut butter is also very comforting. And so it's just, us understanding and having those healthier choices available when we're in those zones of wanting to comfort and satisfy our cravings. Another thing that us as women also we think about birth control. And so choosing the right option it just depends on again, our medical conditions, what medications you're taking currently, or maybe there's other health factors that we're not sharing with our physician. And so it's important that we're talking with our healthcare provider on choosing the right option. And so because now there's a lot of other birth control methods that are out there other than the IUDs. Now there's implants, there's injections, patches, the vaginal rings and diaphragms. So there's so much to choose from when we're talking about birth control, but it does become a factor when we're talking about diabetes care as well. So again, just making sure you're talking to your primary healthcare provider and getting the right option that's out there for you. And again, if you're diagnosed as a pre-diabetic or a diabetic, talking and continuing to check your blood sugars and track those results, track the symptoms that you may be having, and have this list ready when you do make that visit with your primary physician. And I know that sometimes when we talk about when people are checking their blood sugars, most often some of you may feel like it's a failed test. You're doing so good at choosing the right foods. You're watching your serving sizes, your portioning, and you're doing everything that you can control, but it's that blood sugar that's just not coming, that's just not cooperating. And so my best advice is to make friends with these numbers, because it's a lot more than what we're seeing in the number. We have to think about the eating patterns that we have and the times that we're choosing to snack or how often we're snacking. And the other thing is too, it's not just with snacking, it's also what we're drinking as well that do raise those blood sugars. So just keeping note on everything, on your activities that you're doing. And then also, with this topic that we're talking about is birth control. So here we are, we're going to talk about getting pregnant. It's really important that individuals really consider and think of their planning in pregnancy. And we also, because diabetes care is one that really hits the nose on the button when it comes to discussing getting pregnant. And we want to, every woman, we all want to have healthy babies. We want to experience a good pregnancy without the complications. And so planning ahead is really important, because diabetes does make pregnancies harder because of the high blood sugars that do go uncontrolled. And when this happens, it brings on the preeclampsia, what I talked about earlier with the high blood pressure. Okay, remember I talked about high blood pressure and blood sugars go hand in hand. They're both best friends. And so understanding that keeping our blood sugars under control as best as we can. A lot of sometimes delivery can be complicated, and instead of having a natural birth, some cases turn into delivery by cesarean section, the C-section. And also another thing that could happen with high blood sugars is miscarriage or stillbirth. And so that's why when you're getting your prenatal care, it's important to keep your doctor's appointments, and be honest and let your doctor know how you're feeling, what you're going through, and able and so that you're able to better understand what's going on in your body, because you're not the only person that's taking care of that body. You have something special inside of you that you want to grow healthy and to be born healthy and to be able to live a healthy life after they're born. And so this next slide is more on pregnancy, understanding the first 2 months of conception during your pregnancy is a delicate stage, and high blood sugars can complicate this delicate stage of life for your baby. And so we want you to um, be able to have a happy pregnancy and look forward to seeing your baby grow. Because if any complication should happen, a baby may be born too early, or some of the chances that this may happen. Another thing is that a baby may weigh too much, where again it's going to be a harder delivery. And when I say a baby may weigh too much, red flags come up when a baby is over 9 pounds. And so those are risks that should be addressed as soon as your physician lets you know. And also for your baby may be having breathing problems, or maybe experiencing low blood sugar right after birth. And so it's really important that planning the pregnancy and understanding the delicacy of the first 2 months of your baby being formed, and being able to grow to full maturity by the time they're ready to be delivered. And so during pregnancy, this is a type of diabetes complication, and it's known as gestational diabetes, where high blood sugars occur during pregnancy. And this isn't uncommon. And again, it all reflects on how well the mama to be, how she takes care of herself. And so again, touching back on the high blood sugars during pregnancy, women can develop this. And again, it goes back to the risk that we may already have before pregnancy, and that's the overweight or obesity. Having or being pregnant older than the age of 25, or again, if you have that family history. And so if you're just barely understanding what's happening with you right now with your own health history, it's a good thing to want to talk to your family and be able to discuss this openly with your moms or your grandparents. And it's not only just on your side as a mom, it's also on your side, on your father's side, because a lot of these things it could be hereditary. But again, remember I said diabetes is preventative, and if it's a health history that's been in your family for years, then you would want to think about where you want this health complication to stop in your family. And do you want your children to grow up to have these health risks? And so a lot of it is understanding, and again, being honest as a family, as a unit, to share the family health history, where a lot of these health risks that are happening in families can be prevented. And together, everyone does profit and does gain that knowledge on the steps that we need to take as individuals to make that change and be the change for a healthy future. All right. Last but not least, life is grand, and then there comes this sudden stop in the things that used to work so normal, and we were regular on everything until we hit menopause. And so menopause can happen for quite some time, because again, it's just depending on how our body is able to make changes with the health conditions that we bring onto our bodies. And when menopause does show its signs, it all starts again back with on our menstrual cycle. Our menstrual cycle, meaning that 1 month you have your menstrual cycle, and then you don't have it the following month, and then lo and behold, it comes again. And so some people probably already experienced these things earlier on in life. And so with us women, it's always a guessing game, seems like, whether we're trying to find out how everything is going with ourselves, because we think we know in ourselves, I know I'm eating right. I know I'm taking my medication. I know I'm seeing my healthcare provider on an annual basis, or doing diabetes care follow-up every 3 months. A lot of things that just happen with our bodies, and it's just unpredictable. But yet, it all comes down to us better understanding what's going on with our bodies. And so menopause, you could be experiencing weight gain, and that happens in life. We do gain weight, but again, when we do gain weight, we don't want to let a lot of that fat to build up to where it consumes most of our body. And when I talk about fat, we do need some fats in our bodies, because it regulates our body temperature. It keeps our skin moist. It protects our organs, our internal organs. So fat does have its values, but when we tend to put on too much weight, that's when it brings on the health risk of diabetes, heart disease, a lot of other chronic illnesses that we don't want, and that we should be preventing from ourselves. Because when women do gain weight, their increase on need of insulin does happen, and our body naturally produces its own insulin, and that comes from the pancreas. And so that's why when you do have your health visit with your provider, you also want to find out how your pancreas is doing, how your kidneys are doing. And how they find that out is through the urine samples that they take from you when you go for your healthcare visits with your provider. And so a lot of these things, again, so it does depend on how well we're taking care of our bodies and making sure that we're taking and getting those annual visits from teenage to all the way up to adulthood and all the way up to our golden years. I like to, instead of, saying elderly, let's just refer to it as golden years, because, we've lived, our souls and our guas, they've lived this rich life. And with the help of our families, we're able to get them to this stage, to grandparent, to being our grandparents, to being our great grandparents, and just living life to the fullest. And so when we do get to those golden ages, we do want to look forward to enjoying the pleasures of visiting with family and friends, and of course our grandchildren. And so, it's, when menopause hits, it does bring a lot of things to mind on on the stages that we go through in life. And so when we talk about menopause, we're also experiencing, the hot flushes or the night sweats. Some people might not even experience these. And so it all just depends on, when we talk about menopause, it also depends on how early we started having children. It also depends on how later in life we are still having children, and yet we're still having healthy babies. And so again, menopause doesn't happen to everyone at a certain age. And we're going through all these cycles of menopause. But the other thing is, over time, we also want to, the reasons why we want to keep taking care of our bodies is we want to steer away from nerve damage. Okay, nerve damage meaning maybe you don't feel your fingertips anymore. Maybe you don't feel that you step on something, and when you go to check your foot, there's something that's embedded on the bottom of your feet. And so that's the type of nerve damage that I'm talking about. So when we talk about nerve damage and you're experience some tingling in your feet, make it a habit to check your feet every day, because you never know whether you step on a bullhead that's high around this time of season in the year, when we're springtime and it's, all these plants are growing, and that's the main thing that sticks to the bottom of our shoes, and that's the last thing you want to step on. And so just a lot of things. And so once women go through menopause, we're going to always be going through menopause, because again, with women, it's forever changing. We're forever trying to better understand what's going on in our bodies. We're wanting to better understand some of maybe the health problems that our families are going through. And so that concludes my presentation. I don't know if Kellen has any follow-ups with me, or if but I've been with the diabetes program for quite some time, and I enjoy my job, not only because do I have the luxury of doing presentations to the golden population, but we also serve the schools, our communities, and we also sponsor lots of programs in the diabetes program. And so it's all about everything that we talked about today, from making those good food choices. Remember, we're not going to be using good or bad foods, and we're not going to be using the word exercise because that's just too hard. We're going to be referring to exercise as physical activity because you want to still be able to be physically active in doing the walking, running, jogging, planting, gardening, hiking, running after your grandchildren. I enjoy running after my grandson. Just everything in life is such a blessing. And the sooner we start understanding and listening to our bodies and taking preventative measures in better taking care of ourselves, taking care of our minds, and taking care of our families, we're going to all enjoy the longevity of what we as Hopi and Tewa people have in our culture, in our daily lives, in our monthly lives, in our yearly adventures. And so thank you for inviting the Hopi Special Diabetes Program to be a part of the Women's Health Week activities. I am looking forward to my walk on Saturday. So I hope everyone else registers to get in on the excitement and on the events, and have a good life. Itam nekwang katsi yung itam hongvit katsi yes kya kyang itam halai kya kyang pio sufhela kyang hita nekwang hinta ka au yushto tani ya pio ove katsi kayani askwale.
Thank you, Jessica, and I appreciate you sharing your knowledge with everybody. Um, I too was a diabetes health coach at one point, and I understand that, with this particular issues with females having to undergo multiple things at once through their womanhood is very important to understand, starting from a young age to the golden years, and having that shared today is great, and I appreciate your education today. So that will conclude our broadcast of the Hopi Women's Health Week Women and Diabetes presentation. Again, thank you, Jessica, for your participation, and we look forward to more services out there. Thank you, Jessica.